Good morning. It's Dr. Sarita Verma here. It's 8 o'clock in the morning. We should get started. Welcome everybody to this whole school WebEx meeting. We're hoping that we can have a conversation. I think we'll do a presentation at the beginning, but I'm very interested in hearing from you in the chat. And I hope that Vin, you'll keep track of the questions in the chat, or Joanne, just let me know if there are any specific questions, please, because I will have trouble following you with the presentation up. The purpose of this meeting today is to, of course, discuss the implications of the new NOSM University and the implementation of the NOSM University Act. And I will go through some background, and then I will ask Dr. Marsh, David Marsh, to make a few comments regarding research issues that have been raised. Dr. Kathy Turvin to speak to some of the issues around accreditation and the academic programs, especially student concerns. And then finally, Mr. Ray Hunt to address the concerns of faculty and staff, if any. And then we can open it up to a forum. While we're presenting, please take notes and ask questions. This is a safe space, and it's very important that you, as the members of the Northern Ontario School of Medicine University, can participate in what is the beginning of a several-month consultation process. And in fact, this is going to be your university, so it's very important that we hear from you. So bonjour, bonjour, anin, kwekwe, hello. I'm going to share my screen. And just let me know if you can see this, Harshad. Can you see it?
Sorry, I was on mute. Yes, I can.
Okay, good. And if anytime I cut out, bear with me. I'll come back. I've got my MiFi here, so I will come back. So good morning, everybody. The first thing, of course, is that we do want you to reflect on the territory that we are in. That is the entirety of our territory on the homelands of First Nations and Métis people. I do want you to reflect as we look at the attestation of this territory about what that means, especially in these times. The discovery of the bodies of children, not just in BC now, I believe there are discoveries now in Manitoba, and there will be in Northern Ontario, of the legacy of the residential schools. It's heartbreaking, and please take a moment to reflect on our history and our issues. Thank you for that, and I hope that you continue to think about the social accountability of NOSM University as we go forward in that context, in the context that this is Indigenous History Month, and it is also Pride. And there are a lot of issues about inequity and social justice that are part of our schools and our future universities' legacy. NOSM is a key government strategy when it was formed in 2002. And I'm not going to read all these bullets, but one of the big things that you need to understand is that NOSM was never formed as a faculty of medicine of any university. NOSM was created as an independent legal entity. It was actually created by cabinet of the government at the time. It is not part of the Laurentian University Act, nor of the Lakehead University Act. It is governed by its own board of directors. And 90% of the funding for NOSM flows directly to NOSM, not as it would at, let's say, the Faculty of Medicine at U of T. NOSM appoints its own faculty, and it employs you as your staff, and it manages over 1,800 clinical faculty contracts across what we have always called the NOSM campus across Northern Ontario. We do our own administration. The universities, when they were established as part of a tripartite agreement between the three organizations, existed and were highly valued. They are extremely important partners for NOSM and will not be in any way severed. That word is inappropriate. There is no severance going on because NOSM has always been independent. Excuse me. However, at the time when the corporation was created, it was not able in 2002 to register students, collect tuition fees, or issue a degree because it was not a university. And it had no history of being capable of doing that. A new entity had to be created as a corporation, and the two universities were brought on board. And if you know the history, it was originally intended just to be Laurentian University, and Lakehead was included, but it really was about Sudbury and Thunder Bay and those municipalities. It was about the Northeast and the Northwest feeling that they needed to be part of this great initiative. And as a result, the government actually provided multi-million-dollar funding to build the buildings upon which NOSM currently leases on both campuses. As well, because of Tri-Council and other issues, NOSM at the time was unable to administer research grants. And so the three bullets here is what Lakehead and Laurentian essentially provide. Another important aspect that they provide is a joint senate, which reviews the academic component of the program. But unlike what has been said, it is our academic council that actually provides the academic oversight. And the technicality of the Joint Senate has never actually turned back anything to do with NOSM's curriculum. It does not participate in the accreditation, and the accreditation report does not go to the presidents of the universities. It comes to me as president and CEO of our corporation, and through me to our board of directors. When applying to the CPSO, for example, or any other college around the country for a license, our graduates, when they become residents or when they go into practice, in CPSO, it is NOSM that is listed as the place of education as the university. And indeed, for the CARMS match, it is NOSM that is listed. There has never been a history of listing Laurentian or Lakehead as the universities. On June 3rd, 2021, the NOSM University Act was passed, and on the same day, unusually, an hour later, it received royal assent. I'll explain what that means, and I think for all of you, I think I captured everyone. What does this mean for students, for residents, for staff, faculty, our unions and our full-time faculty, and our Unit 2, our partners, many of whom were concerned about the alleged lack of consultation, and of course, about the fact that our partners felt that they had been told that they had been betrayed. To community, and of course to the public, what does this mean? Well, before I get into the meaning, I think what I want to do is explain to you that there is a big transition that will happen, and nothing is like a light switch that gets flicked on and off. In essence, right now, I want to tell you about the legislative process. How did this happen? What happens with regulations, and what the transition project team will be doing over the next several months, possibly even a year, depending upon how quickly we can get things done. So there was no request for degree granting status. The board of directors at NOSM on early April actually had considered multiple options in light of the insolvency of Laurentian. And the option that they had recommended was to explore the possibility of degree granting status. However, on April 15th, the government introduced legislation to establish NOSM as an independent standalone degree granting institution. Now you're going to ask me, which everyone has asked me, well, how much did you know? What did you know? When did you know it? And how come you didn't know? And did you ask for this? And how does this happen? My answer to you is I don't know. There were a lot of issues at play, but the reality is that many institutions, including NOSM, were navigating towards full emancipation anyway. Lakehead itself was a technical institute and became a university. The Ontario College of Art and Design, Algoma University. The natural history of higher education institutions, as you will look at it from the government perspective, is that they eventually, if they are of high quality, will evolve into a freestanding degree granting institution. And with regionalization, which I will describe, and of course, expansion of the medical school, which should not come as a surprise to any of you, the government was considering many of these options. There is no doubt that much of this was triggered by the financial, I'm going to use the word decapitation of NOSM as a result of the Laurentian insolvency. But Laurentian had put itself under a protection of a CCAA proceeding. And because of that protection, NOSM could not actively do anything. And I could not legally do anything, nor can I now, to interfere with that CCAA process. The NOSM University Act passed third reading and received royal assent on June 3rd. And a NOSM transition team has been established. Very quickly, what happens after an act is created is that there have to be regulations for the governance of a university. And although the act does lay out the composition of the Board of Governors and of the Senate, many of these issues will have to be sorted out in regulations and in bylaws. And the regulations will establish the first bylaw of the university. It will probably address the issues of the recognition of credits. You don't just switch a university. Those credits of the students, which is why we're here for our degree programs, have to be transferred over to the new university. The vesting of property and the assumption of obligations, including contracts and collective agreements. So in order to make this transition, which, by the way, nothing can happen. We can get organized, we can start planning, but we need to be proclaimed in force. And that may probably happen in bits and pieces over the summer, and it may happen by the fall. But the implementation of the act means that we need to provide input to the government to establish the regulations and to do the things that many of you are concerned about. But the message here is, don't panic. We have lots of time to register learners, to collect tuition fees, and to provide student support. That's our number one issue. To ensure that there's a seamless transition for all our learners. To advise on the research administration. To transition, develop, update, and revise our policies and procedures. To review and identify all contracts for continuance and amendment, and to ensure that the accreditation requirements are met for all degree programs. I'm going to pause there and say that there is no validity to the allegation that has been made that this will cost millions of dollars. Our current budget will be sufficient to continue business, but there will be some new one-time only startup money. And our main increase in funding will come from expansion of the medical school, which is identical to the expansion of the other medical schools' funding. Also, there is no, I repeat, no impact of this legislation on the accreditation. There will be issues to be addressed, but I have made it very clear with the Committee on Accreditation of the MD program that other than clarifying some governance issues and the financial sustainability, there is not a withdrawal of accreditation of the MD program. Those two rumors need to be stopped. So this is a busy slide and you may not be able to see this, but we will post this on the website so we have full transparency. For those of you who know me, I'm a physician, a family doctor, and a lawyer. And between those two roles, I can assure you transparency is very important. There's no secrets here. You will all be part of the transition, but we need a team. And a lot of people will be involved. Dr. McCready and I will co-lead the transition executive lead. We will have a major communications and external relations process. Grace Vita is the project manager for the overall project. And on the academic side, it will be Jacqueline Kopp Rasmussen. The co-lead for the academic side is Dr. Chervin, and the co-lead for the administration side is Mr. Hunt. There will be ongoing consultation with OPSU, Unit 1, Unit 2, and with all our partners, as well as with government and students. Specific transitional issues include the continuance of our existing relationships, and importantly, again, this may be terribly Law 101 for many of you, but here you go. NOSM Corporation, the not-for-profit corporation, becomes a corporation as a university, but all the corporate activities continue. This is laid out in the Act, and there is no reason to be concerned that the prior obligations of NOSM will not continue under NOSM U. We will have to work out learner registration and the collection of tuition fees, as well as the transfer of credits, as well as learner benefits and services. All of this work is underway, and Dr. Chervin will speak more to that. Faculty appointments will continue. The specific issue of joint faculty appointments under the current relationship agreement between Lakehead, Laurentian, and NOSM. That agreement continues. It has not been broken, but there will be a negotiation of separate agreements. And it's our intention to lift all boats, that we all benefit from all of these joint appointments, as well as supervision of graduate students and all the other issues that Dr. Marsh will speak to. Specifically, endowments and fundraising will be important for NOSM because our endowments at Laurentian are at risk. You know this, it is publicly known. They have $14 million of our endowments, which usually generate $500,000 in interest for student bursaries. I can guarantee you we will find the money to continue the student bursaries, even if we have to borrow it, because their students are our #1 priority. However, those endowments are not guaranteed. So we need to talk about raising money to replenish those endowments. And then finally, this is a big change management project, and it will be important that we all participate in managing your anxieties and your expectations in change. It won't be perfect, but I want you to know we've got it. You're all on our radar. All the issues that you raised and the questions that you sent in advance are already on our work plan, and we are addressing all of them. But if we miss something, tell us, because frankly, we've never done this before. So I've never navigated a school to a university, but I can tell you I'm learning a lot, and I'm following many people who've done it ahead of me, including Algoma University. We will not be going away or veering away, sorry, from our strategic plan. It stays in place. NOSM has not changed when it becomes NOSM-U. We will still transform health human resource planning. In fact, our biggest problem is that there is a critical crisis of physicians and allied health workers in Northern Ontario. So enough of this bickering and enough to get on with the job that has to get done, which is I came here to help Northern Ontario, to help its health, its wealth, and to improve health. And we're all in this together. So let's get on with it, because again, the bickering and the infighting and the ongoing negativity needs to end. I'm past it now. So let's transform health human resource planning. Let's advance social accountability. We are innovating health professions education ahead of anyone else in the country, and we will be applauded as we go forward with our new pathways in rural generalism, Indigenous health, Francophone health, and in fact, urban health, mental health, and addictions. Finally, we will strengthen research capacity in Northern Ontario, and we will always do that by valuing you, our people, resources, infrastructure, and resilience. I'm not going to spend time on this, but I just want to ground us back into why we're all here in the first place. We're not here for anything except that NOSM was created. It wasn't created for any other reason but to address the health challenges in Northern Ontario. And folks, if you haven't heard about Attawapiskat this morning, if you haven't heard about the increase in the outbreak of the pandemic in these areas, if you haven't heard about food insecurity, if you haven't heard about the violence in our society, you're in another world. If you're caught up in some kind of little pod of your own, you need to wake up, because Northern Ontario needs us. And NOSM was recognized by the government as being the strongest, most spectacular asset in Northern Ontario. We have proven that we can do it. We are producing the most remarkable graduates. We have the most amazing research. We have the most spectacular faculty. And so we can actually address many of these issues in Northern Ontario. And right now, we're at a major crisis for physicians. Despite NOSM's great success, as it stands right now in Northern Ontario, at a minimum, we need 313 full-time equivalent physicians, of which 126 are family doctors, of which 86 are desperately needed in rural communities. That is, 313 is the equivalent of 5 years of graduates from NOSM's MD class, and we have a lot of work to do. So we're not leaving Thunder Bay, we're not leaving Sudbury, we're not leaving the Northwest, we're not leaving the Northeast, we're not abandoning Indigenous health, we're not abandoning French and Francophone issues, we're not abandoning rural generalism or any form of leadership, but we are going to build our residency programs, because we also need 160 Royal College specialists, and those will predominantly be based on the hospital systems, and we hope at Thunder Bay Regional and HSN, because that's where the Royal College training will occur. So this is where we are at now. I mean, I'm not sure why people think that we're only based at Lakehead and Laurentian. Those are two universities that were a very highly regarded partnership and continue to be our flagship campuses. No doubt, we will negotiate with them if they will let us to stay. It will be up to them about the relationship. I can assure you, I want to have a positive, very strong relationship. But we have concentration from Kenora to Sioux Lookout to Manitoulin Parry Sound, North Bay, Timmins, and Sault Ste. Marie. We have a large concentration of people learning and teaching in these areas. So we've always been a distributed, community engaged learning model. Next steps. This issue about consultation is that we need to do it. You need to tell us what NOSM University will look like. I will be having, and I will be on the road or on WebEx, in meetings with key partners, municipalities, hospitals. We will have public town halls. We will have focus groups, including a social accountability focus group in the East and the West. We will do semi-structured interviews. We will come to all your committees. If you have a meeting coming up, please let Vin know, and we will schedule in a meeting with you. NOAMA, the legs, the faculty, the unions, the students, the staff, the faculty, the donors, and we will also do a survey. If you have issues, nosmu@nosm.ca. So the timeline is actually between July 21 and June 22. And our goal is to have the Board of Governors, the Senate, the Chancellor, we got a new Chancellor, and of course to have the students convocation by next spring, this time next spring, so that the new class that graduates will be able to graduate with the NOSMU degree, and we have a lot of work to do. And nothing will happen without consultation. If you feel you're being left out, you need to let us know, nosmu@nosm.ca. And I know the last word I will say is that I've heard a lot about the fact that people think, oh, what the heck, what's this name? You know, I get it. We could have called ourselves, I don't know, something spectacular like, you know, the Northern University or something, but our brand is NOSM. And the act is called the NOSM University Act. So for now, you know, let's go with it. Going forward, I'm sure there will be opportunities in the next 5 to 10 years to grow the school, to develop new programs in allied health, to look at the humanities, to look at lots of things. That this university is not alone, and it's not just a medical school. One of the things people keep saying is a medical school needs to be part of a university. We are a university once we get proclaimed in force, and the Faculty of Medicine will be part of that university. But there are great opportunities to take on a number of really fascinating and great ideas. They will have good business plans. They will be supported financially by government and through other sources, and we will be successful. So I'm going to stop there, and I will stop sharing my screen. So good morning. I know that was a very course in law, but you know, never before have I been able to employ my skills as a lawyer, doctor, and senior administrator. So it's very exciting. I'm gonna just see, there aren't any questions that I can see in the chat. So I'm going to turn this over to Dr. Marsh. Dr. Marsh is the Associate Dean, Research, Innovation, and International Relations. David, over to you.
Thank you, Dr. Verma. Good morning, everybody. I'll just build on Dr. Verma's comments in a few areas related to research and graduate studies. First of all, as you all know, we do have a graduate studies program within NOSM, the Masters of Medical Studies. By the time the first students finish that program, they will convocate as NOSM graduates. So like the MD degree, the MMS degree will be transitioning over to becoming a degree of NOSM University rather than a joint degree of Lakehead and Laurentian. There are a lot of issues about graduate students from Lakehead and Laurentian who are supervised by NOSM faculty who do their research in the laboratories on the buildings of NOSM and so forth. We're very aware that this is important, that it's key that those students are able to progress through their programs and graduate, that supervising graduate students and to a lesser extent undergraduate students of Lakehead and Laurentian is important for the research productivity of our faculty. Nothing in the current relationship agreement has changed, but as Dr. Verma said, we will be negotiating new relationship agreements independently with Lakehead and Laurentian, and we're very aware that it's important that our faculty continue to have the opportunity to be primary supervisors for graduate students who are registered in programs at those universities. So that's definitely a factor that we'll be bringing into those discussions, and I have already had a chance to start discussing that with leaders at at least one of the universities. The next issue is about research ethics boards. So under the current relationship agreement, any research study led by a NOSM faculty member needs to be approved by an REB at either Lakehead or Laurentian, and often both. There are mutual recognition agreements between Lakehead and Thunder Bay Regional and between Laurentian and HSN. So I know a lot of our clinical faculty will go to the REBs at the hospitals, which are recognized by the universities. We will be developing a plan over the next month or two to clarify whether or not we need to have a separate REB for NOSM University. I expect that's likely to be a requirement in order to ensure that any research study involving NOSM faculty members or NOSM learners has an REB of record that's recognized by NOSM. If we do establish our own REB, then we'll pursue mutual recognition agreements with Lakehead and Laurentian and HSN and Thunder Bay Regional, but also with other REBs that our faculty have been using, such as the one on Manitoulin Island, Merck, the REB in Sioux Lookout, and so forth. Our goal will be a system where you only have to apply to one REB, and that recognition will then be recognized across the other REBs in Northern Ontario. It could include Algoma, Université de Hest, other potential REBs. This really will help move us towards a more efficient system and also allow the NOSM REB to get a collection annually of all of the research studies that involve our faculty and our learners, something that's has not actually been possible under the previous arrangements. The next item I'll speak to is research funding. So we are in a transition period, as Dr. Verma described. Currently, NOSM is not able to administer tri-council agency grants, and there are many other granting agencies who insist on the funds being administered by an agency that can administer tri-council grants, like MyTax, for example. Our faculty have existing grants that are being administered at Lakehead or Laurentian or HSN or Thunder Bay Regional. None of that automatically changes. All of the current agreements continue to stand. And in our negotiations with Lakehead and Laurentian, we will obviously take into account the transition period. In particular, it's important for faculty who have grants being administered at Laurentian that you continue to have those grants held at Laurentian. I want to discourage any of the faculty from making decisions that might trigger those research dollars to fall under the creditor process under CCAA. Laurentian's been very clear, as long as you're continuing to have your existing grants administered there, they will not fall under the creditor aspect of the CCAA, and over time you'll have access to the full dollar amounts that were awarded. So continue to follow that process. Stay in touch with the research office, research@nosm.ca, and we'll help you with accessing those funds. As you're planning to submit new grants, follow the research newsletter, and we will be pursuing the ability for NOSM University to administer tri-council grants. Historically, we've not been able to administer NSERC, for example, because we were not a degree granting institution. We will be becoming a degree granting institution with degrees that NSERC will recognize, that will be recognized by other universities in Canada. And that should allow us to be able to administer grants from all of the tri-council agencies. There's a very clear process that we have to work through to get that ability. It will involve us establishing some policies and procedures, some additional staff. In particular, we need to have policies and procedures approved by our Senate and our Board of Governors, which have not yet met. So that's also not something that we can turn on in a day or two, but it is a process that we can put effort and time into making happen as soon as possible. So I think I've talked about the REB, research grants, faculty status. Animal care is another important aspect of supporting research. I think everybody's aware that the animal care facility at Laurentian has closed. We continue to have access to the animal care facility at Lakehead, at Thunder Bay, the one that's administered by the Lakehead Animal Care Committee. Actually, over most of the last year, the only person using the facility in Thunder Bay has been an NOSM faculty member. We've started discussions with HSN. They have a part of the HSNRI facility at Walford Road that was built to be an animal care facility. It's never been activated. We will have to establish an animal care committee and get certification for that facility with HSN, working in partnership with them, so that the NOSM faculty members in Sudbury will have access to an animal care facility in Sudbury. As I say, we've started those discussions, and we'll be working through that process as well as quickly as we can. I think those are the key issues as they relate to research, and I'll be happy to answer questions in the chat. I'll hand it back to Dr. Verma.
Thank you, Dr. Marsh. And I think the main message here is that although there's a tendency to believe that change is threatening and bad for you, the reality is it's actually not. The enhancement of the possibility of a multiple acceptable REB across Northern Ontario, the possibility of maintaining and continuing research grant administration for now until it transitions to NOSM University, and of course the maintenance of potential supervision of graduate students is actually in everyone's best interest, especially Laurentian. But it's also great for Lakehead, and it's no intention here. You know, people use the word divorce. There's no divorce going on. This is the evolution of one partner who will become a really strong integrator to two of the great institutions in Northern Ontario, but will also leverage the strength of other higher education institutions, including Algoma, Hearst, Sudbury, and the colleges, because we will be actually gathering multiple multidisciplinary research opportunities, and you will all actually see your opportunities explode with interprofessional, trans, northern, and population health research. I have a vision for this. It's going to be incredible, and I would stop worrying about the fact that the devil's in the details. We've got this. The good news is that the Tri-Council grants will be able to be administered at NOSM University once we get all our ducks in a row, and you will not see a major disruption in your research. So thank you, David. David and Patty Fink have this, as do TC and Dave Savage. I'm going to go over to Dr. Chervin for a brief coverage of the student issues and accreditation issues. Thank you, Dr. Chervin.
Thank you very much, Dr. Verma. Can everybody hear me? Quick thumbs up. Yeah, good. Okay. So a few main messages I want to give to all the students, residents, and other learners on this call. First of all, that we will continue to support learners' needs and respond to your concerns. Reach out to us. We are always happy to hear from learners and want to address your concerns and issues. Secondly, wherever needed for the next year as we transition to NOSMU, we have good processes already in place, and they may need to be followed. And as Dr. Verma said earlier in her presentation, our goal is to make this as seamless as possible for all of you. The new NOSMU processes will be developed in consultation with you, so that anyone who is affected by a change, any group, will be involved in developing the new process. And our aim is to have less red tape, and that the processes are tailored specifically to medical and health science learners' needs and graduate students, as Dr. Marsh has said. So that that is one of the advantages of NOSMU, is that we're not following processes that are geared to larger universities. There are a few key issues for undergrad medical students and all learners. The first is student services. So we are in the process of establishing a new NOSMU student union. All the medical students have paid fees to Laurentian and Lakehead to get those services that were administered by the university. And with the new student union, we're determining what the previous fees supported and what we need to provide to you, the medical students. We certainly will be providing personal counseling, health insurance, and health services that are suited to medical students. Some of the other things that those ancillary fees covered may not be needed, but that will be determined in consultation with you. Accommodations, and by this I mean not housing, but accommodations that are needed for academic and clinical work. We are at this point working to document and understand the current processes that are in place within a NOSM accommodations committee, the resources that are provided. And over the next year, we will create a NOSMU process that will ensure appropriate assessment for needed accommodations, confidential storage of any private health information, and a whole school approach that ensures complete confidentiality for the transition from NOSM undergrad to NOSM postgrad prior to the CARMS match. And finally, with accreditation, we are in regular contact with the Committee on Accreditation of Canadian Medical Schools, and there are no standards that are really significantly impacted by the transition to NOSMU. And accreditation of the postgrad programs, Northern Ontario Dietetic Internship, and Medical Physics program are not affected. Those happen through the colleges. Registration, tuition, and OSAP, we are working on a process and we will communicate well in advance with all of you. We will know more in more detail by July 15th. So stay in touch, stay tuned, and you will hear from us, and we always want to hear from you. I'll stop there, Dr. Verma, and happy to answer questions, of course.
Thank you so much, Dr. Chervin. And I should say to the medical students, our communications are through your NOMSOC president. So better to go through Connor or the VPs, because we are working closely. Grace Vita is working with them to establish the student union and to make sure all of the issues, many of you have mentioned bus passes and all the things we need, we know that, okay? But again, get in touch with them, let us know. Rather than having 400 people contact us directly, we'd rather you went through your presidents. For the residents and the dietetics, the physician assistants, and the grad students, for PG, please go through your program director to the PGME office, HSP office as well. And let's try to make sure that we cover all your issues. We're a student-centric university. We will be known for being student and learner-centric. We will be known for being here because you're here. We're supporting your degree. It's a main reason. So for us to screw that up would be dumb. We don't want to do that. We want to be part of supporting you. However, as I said, there may be instances, one-off instances where there's a unique issue that we don't know about. So it's going to be up to you and to tell your colleagues to let us know. As far as tuition is concerned, people have asked, oh, well, does this mean you're increasing tuition? We have no say in the standard of setting of tuition. Tuition is set by the government. And right now, as far as we know, there's a freeze on tuition. It has not been lifted. There are always the possibility the government could increase tuition, but that's no different than it was before NOSMU. And as far as all of the other issues are concerned, if you want to pay your fees now, if I could just ask you to wait until mid-July and don't pay anyone anything, we will definitely set a date that will let you know when to pay your fees and what to pay. And it may be that we continue with the current arrangement for one more year because we can't get everything in place. It's better not to rush something, just to be enthusiastic and passionate. It's better to wait and to do it the right way. So we have great people like John Friesen and Marion Kane and Lee Toner all working on all of these issues. And, with Grace's leadership and Dr. Chervin, we really have this in hand. So last words over to Mr. Hunt from the perspective of the COO, IT, HR, finance, all of those issues that are in his empire.
Thank you, Dr. Verma. So This all sounds very daunting. So we've been updated on the processes to deal with student registration, tuition fee collection, the whole notion of research administration. So all these changes will require regulations that must be passed by the government of Ontario. And just to put everything in perspective, legislation's passed, so we received royal assent. So it is now a statute, it's now law, but it's actually cannot be enacted without regulations. And so much of the items that have been raised so far will require processes, but also regulations to actually make them effective. Currently, Dr. Verma, through Grace and I, are working with Ministry of Colleges and Universities to establish timelines. So again, the legislation that was driven by government, as will regulations, and we have no control over government's regulations, their timelines, their schedule. If the government tells us that they plan to introduce regulations in September, then that will dictate to us when we register students at NOSM University. So really, we're at the mercy of government. Our job in administration is to build all the systems and processes to support the academic area of the school and research area in order to accept payments, register students, process fees, etc. I can assure you that our team is working diligently as part of the transition team that Dr. Verma mentioned to start designing the systems. We want this to be as seamless as possible for our students. We are currently looking at a system. It's for anyone's information, it's called Colleague, but that's the student registration system that our students currently use at both Lakehead and Laurentian. We have a team that's been assigned. Steve Kelly, Lori Piccolo, and others, Mike Johnson, are now starting to design that system. It'll be seamless, as I said. When students eventually go into our system, it'll look and feel the exact same way as it did before. So again, we're just trying to make this as easy as possible to transition. The fees that we currently pay Laurentian and Lakehead to register students and do other administrative duties, those monies will be obviously not sent to the universities, and they'll be used to help us in hiring staff within our own organization to now provide these services. Each week, Lynn Aubrey Yates, the Director of HR, and myself have been meeting with both OPSU 1 and OPSU 2 separately to engage, to collaborate, to make sure we're capturing and addressing any issues or concerns that staff and faculty may be raising as part of the process. Dr. Verma made a really important point earlier that this is all of our school collectively. It's not, the school does not belong to one individual or one part. It's all of us. And so it's very important that everyone's voice is heard during this process. And we will endeavor to make sure we consult with everybody who is affected by NOSM University. This is not a matter of flicking a switch. It'll be a long transition. So we're looking at incremental changes. The analogy I always use is we don't want to boil the ocean. Let's look at what we need to do to get to September. What are the first things we have to do to register students and collect tuition fees, and then move on from there. The process of negotiating new relationship agreements individually with Lakehead and Laurentian University is probably the most important first step. Without that, we can't speak with Government of Ontario to establish regulations. So the regulations, for the most part, will be driven by discussions we have with both universities. And the relationship agreements that I'm talking about are ones that have been in place since probably 2005, and they were a tripartite agreement. We're now looking at bilateral agreements covering areas such as buildings, lease, maintenance, and other areas of administration. So this is, I guess, my work plan for the next 2 to 3 weeks. And finally, we are meeting with the ministry this afternoon. They'll hopefully provide us more details and clarity on their schedule and when they plan to bring regulations forward. And then that'll dictate our work plan as well at NOSM. So I'll stop there, Dr. Verma, and if anyone has any comments or questions on the administration side, I would be more than pleased to answer. Thanks.
Thank you, Mr. Hunt. So, I don't know if anybody knows this, but I'm a Methodist. and Methodists never go into debt, right? I mean, they actually, my mother would just smack you if you had, a big credit card debt. So first of all, like, there's no way that our team, and I think the team is all turning into Methodists as well. Our team is not going to actually go into debt. We've been asked to do a lot of rescue of a lot of programs from Laurentian and do this and that and the other. And people are reaching out to me to say, well, let's partner about this great thing. All of that's great, but we actually have to let the dust settle and get our work done. And there's no way we're going to take on anything new that is going to cost more money. Our business plan that we're negotiating for the one-time only startup funds was anticipated. There's no way that even MCU would think about doing something without actually saying, yeah, I think you need a university registrar because you're going to become a university. Aspiring registrars, take note. You're going to need, support for all of these student services. We might have to contract out, a psychiatrist for all of us. I'm not sure, but I don't know if there are any psychiatrists on the call. Anyway, so, there's the message here is like, why would I certainly and our team take forward anything that's going to cost millions of dollars? It's just, silly. We actually need to look for efficiencies. And I do want to set the standard for universities. Our university will actually be very efficient. That's to say that we're not going backwards, by the way. Our important thing is not to get people frightened about big changes. Enough change. The second message is that although, we're doing all this, the reality is we're doing it in a pandemic where there is a really scary variant coming out there. And, we're seeing surges now, although it's always weird. The government and other people say, oh, we're going to open up the borders and we're going to travel again. I don't really know. I feel quite nervous about the variants, and I'm sure you do too. And we're all weary, right? I mean, this summer, I want everybody to know, we know you're tired. We know that the students have been coping with uncertainty for 2 years now. We know that that level of uncertainty can wear everyone down. So your wellness and your sustainability is important. I will admit to you that the team and myself, we're probably burnt out, but we're going to find our next gear. As Novak Djokovic did in the last French Open final, for the tennis fans. But, we can find a gear, we can find another gear, and we'll get through the next year, but we are tired. And so we know that, and everybody, post-grad accreditation's coming up in the fall. There's a lot going on. The core business has to stay solid. So we're not going to dump more on you without giving you additional help and resources to get the work done. And if we can't do it, we can't do it. It's okay. But the message there is take your vacation and pace yourself, because it's going to be a summer of fun and a summer of activity, but it's just going to be a summer of hard work as we go forward and do all the consultations. My last message to you is, listen, this is a fantastic group of people. I am so inspired to be part of NOSM University and all of you. And I mean that with great respect. Respect, collaboration, and transparency are important values for us, as is social accountability. And so, I hope that you know that we respect you, we value you. And as I said now about 5 times, I'm sure we're going to miss something. So I'm going to count on you to let us know. Don't sit there and fester and be, angry about it. Let us know, because I don't have ESP. I've been working on it, but it's not there yet. And I lost my amazing Kreskin hat. That's a shout out to people from 50 years ago. But the reality is, I don't know. I mean, even David, Kathy, Ray, and I, we are trying to anticipate all the issues. I think we are. But if we aren't, or if there's something unique to you, you have to send a note to nosmu@nosm.ca. Now, that's a shared email. So if you want to send me, a love letter, don't send it there. But send, send questions to us. So thank you very much, everybody, for listening so far. This is now your time. Happy to take questions. If you have a question, bring us forward. I do want to turn to Kimberly Larkin. Kimberly, do you have a question from the floor?
I do. We had one submitted. So the question is, however you view the validity of the concerns raised by our university partners of this process, it seems nonetheless to have fractured relationships in important ways. What specific measures do you foresee will be needed on NOSM's part to repair these relationships, given the critical role these universities play in the North, and our need to work closely and constructively with these partners in order to transition many facets of our work?
That's a great question, and it's one that's on everyone's minds. I think it's actually the first question I get at every session I have, and I've only had a couple, but you know, it's a really good question. Let me just say this. First of all, there hasn't been a problem from my perspective. I did do a little defense, mechanism issue early on when some of the allegations were being made. But here's the reality. Like, as far as Dr. McPherson and Lakehead is concerned, they were just doing their job. Like, I totally understand. If I was in their shoes, I'd probably have been kind of, upset too, because they're, have some concerns. Importantly, I've already reached out to them, and we're going to have a meeting pretty soon. I've already had one meeting with the provost, and he's actually technically the chair of the NOSM board. And really, I think I'm quite optimistic that, having recognized we're all doing our jobs and we had to do certain things, we can actually sit down together and go forward. So I am not at all concerned. Andy Dean and David Marsh can talk, myself and the provost and the leadership and Dr. McPherson. I came here because Dr. McPherson recruited me, and I have great respect for her. So, there's no concern. It will be up to Lakehead in particular, depending upon how they want to go forward. But all the signals are that, listen, I think they had some concerns, and they brought them forward. And if they hadn't, they wouldn't be, doing their due diligence. So good for them, and we'll go forward. As far as Laurentian is concerned, that's a bit more of a tricky situation. And we're going to go ahead and meet with the new chief redevelopment officer and the monitor of the university. But the CCAA proceedings are a very complex legal environment. And I mean, we can sit down with them. If they decide they want to negotiate with us, as they did with Huntington, Sudbury, and Thornlow, then they can restructure with us. But they have to decide they want to. All the signals from Dr. Hachet's newsletter last week, and from his affidavit to the court 3 weeks ago, seem to indicate that they actually feel that that's a good thing going forward. So I actually do not see any problems. Tammy Eager and David Marsh have been in close contact. I think, Ray and I need to figure out how this tax issue and this whole, the CCAA issue is going to interfere with our ability to go forward. It may be with Laurentian that we can't do anything until CCAA is over. I don't know. But the issue is not Laurentian or the people, or Lakehead or the people. In Laurentian's case, it's the legal situation. And I certainly don't want to be in contempt of court. So, bear with us. It's really complicated and, not fun. But we are going to do what's best for NOSM. If it comes down to the fact that we can't make any changes either way because of CCAA and we have to wait, then we have to wait, unless we go to the government and ask them to make a motion to have us lifted out of the CCAA. But that will probably, if I go into detail on that, everyone's head will explode on the screen, and I don't want to see that. So next question.
I do have another one, and this might be for maybe John Friesen or Kathy Chervin. What sort of positions will there be on upcoming committees for students, if any?
Hi, it's John here. Well, we have many student positions on the vast majority, if not all, of our academic committees, and any other committee where students' interests are impacted. So it's hard to say right now what committees, because we won't know exactly which maybe new committees we may have to form. But I can say for sure that the moment we have a committee, if it's new, that speaks to or has an impact for the students, then if and when, as much as possible, we will include students on that committee. And if we can't, for whatever reason, we'll make sure that there are student council reps that are fully aware of what decisions and discussions that are being made.
There will be an opportunity, John, in the new Board of Governors for one student or one learner elected across all programs amongst their peers. So there will be an election run by Gina Kennedy for that position. And there also will be an opportunity for 8 learners on the new Senate, which is fantastic. Those are, unheard of. Currently there's no student officially on our board unless you become a board member through the board process. So I'm really excited. And by the way, since I have the floor again, I just want to say one more thing. We have a fantastic board. I mean, we have an amazing board of directors. They have done so much heavy lifting over the last little while. I really want you to know that they're awesome. I don't know if any of them are on this call, but I want them to know. And we actually have some great friends of NOSM as well, including the former mayor and Order of Canada recipient Jim Gordon, who really has been in the back way a great advisor for me. So again, some great friends for NOSM, Ken Boschkoff, really fantastic people. Does NOSM University intend to offer new undergraduate programs in the future? Well, that's a great question. I think the world is our oyster, so to speak, in the future. Already I've been approached by some programs that were terminated at Laurentian, many of which you would think of. Absolutely. But as I said, I think for the next year, we need to just do our job and get our university in place. As I said, a university can have a faculty of medicine, a faculty of health sciences, a faculty of innovation. We can actually grow. It won't happen in the next year. It probably won't happen in the next 3 years. But I would say that a decade from now, NOSM University will look quite different, including it will have a rich and robust faculty complement. We are very small full-time faculty. We need to grow that. It will have a rich and robust research endeavor. Right now, we're really small. So again, a lot of that will grow over time. I always tell people use Google Space and go up into space and look down at NOSM U, and it'll be a tiny little dot. But 10 years from now, there will be a red line or a blue line that shows its trajectory. And I will anticipate this is the beginning of a real excitement for other undergraduate and graduate programs. I've also spoken about joint degrees. I'd love to see a law medicine degree with Lakehead. And I'd certainly like to see more Indigenous and Francophone programs that have been let go from the Laurentian side. But again, nothing's going to happen right away because we all have enough work to do, and we're in the middle of a pandemic. Other questions, Kim?
There aren't any other questions that came to me privately. There's a couple of comments. Would you like me to read those?
I think, William, thank you for your comment. And Kathy, thank you for your comment. I don't think we need to read them, Kim.
Okay.
But I'm very proud of everybody, so thank you. I think one question I have is, and we can ask this again, is, we're going to do this whole communications process. You're probably going to get sick of me. It was like the strat plan. I showed you that video so many times. People are like, enough. But I think that we should keep talking for community, especially for Indigenous partners, stakeholders, Francophone partners, stakeholders, and municipal partners and stakeholders, as well as hospital partners and stakeholders, not just the 2 big ones, but all of the northern teaching hospitals. We really need to be out there, and I'll be out there, but I'm going to count on you all to be NOSM ambassadors. If you do a good job, we'll send you a pair of socks. It's really important that you participate. We'll count on Danielle and Yolanda and Rahim with our donors. And, we have many of you who are really important ambassadors. Students, feel free to tell everybody this is going to be a fantastic university. You're going to be part of the, well, most people think we already were a university. So, I think be proud.
I do have one other question I've just received that's not related to this issue, but the question relates more to COVID. So with the slow reopen, what's NOSM's return to work plan?
I'll let Mr. Hunt answer that, or Lynn.
Thanks, Dr. Verma. So we're just finalizing a number of options and a plan that we're going to bring forward to executive group of NOSM. Much of the plan, of course, is always dictated by the Government of Ontario's Opening Ontario plan. We just entered step 1 of a 3-step plan in Ontario. The allowance of NOSM to continue to operate over the last year was based on both regulations and direction of government, and we anticipate that more direction is forthcoming on the opening of universities and post-secondary education institutions. So we'll take a lot of our cues from that, but we are finalizing a plan right now, and it's multi-pronged. Obviously, we have staff and faculty. Some staff will need to be here to support academic programs that are mandatory and require people to support that. We're also looking at flexible work arrangements, and we learned a lot over the last year and a bit on the pandemic in allowing and enabling people to work from home. So we'll have sort of a mishmash of processes where sometimes people are working at home, sometimes are on campus. There'll be a requirement, as I said, for scheduling of people to be here to support programs. And lastly, we're just also finalizing the process to keep track of those who have been vaccinated. It's unlikely we'll have mandatory vaccinations, although we're looking at legal options on that. Many organizations have not made it mandatory, so it's unlikely we will either, but we will have processes around those who have been vaccinated and those who have not. So just stay tuned, and yeah, we'll be communicating that within the next month.
Thanks, Ray. And one hopes that as long as the Delta variant isn't too persistent, we might be able to be looking at, a return to campus with modified work arrangements in the fall. And a lot depends upon travel as well. We've been sort of staying at each other's campuses, and if some people have driven back and forth, but I'd love to get back to Thunder Bay and revisit the clothes that I left there. And so, yeah, as a family doctor, I think I'm not saying this as the dean, but I highly recommend getting vaccinated. It is good to get herd immunity, and unless you have a underlying medical condition that prevents you from being able to do that or previous adverse reaction, but society is probably going to want that to happen. And if, lots of information out there about whether you continue with dose 2 of AstraZeneca or whatever, but make sure you talk to your public health unit and get that information from them. Well, I must say that in over a year, we've come a long way on WebEx, being able to share screens and talk to close to 250 people and conduct business. I'm really impressed with our platforms. Thank you, Steve, and to everybody in the management group and executive group for all of their work. As I said, to our board, and of course to all of you. Students, don't lose heart. It's just going to be great. We're going to have, all kinds of really neat paraphernalia that says NOSM U on it. And we're going to have a new chancellor. So if anybody is friends with anybody who's famous, no, just kidding. But we are going to have a search. So actually, I forgot to mention that we'll probably have student input on that as well, including many of you. So stay tuned. Any final words from anybody or? Okay, well, we finished a bit early. You have a bit of fun time in your day. Everybody have a great, safe, and hopefully relaxing summer. Everybody enjoy yourself, and thank you everybody for being here today. Take care.